A new analysis has come out about U.S. healthcare, and no surprise, it's bad. Like, real bad. Not that we didn't already know this already, but the details here, well, let's get into them. Just how bad it really is. Now, according to this analysis by the Commonwealth Fund, the U.S., and again, this is the stuff that's not going to surprise you, we spend more on healthcare than any other high income country in the world. Okay, we know that. This is on the basis of both per person cost and share of GDP. Another thing that we are not surprised is that we have worse health outcomes than any other of the high income countries. So now the reason that I have to talk about this is that you'll run into people like Ben Shapiro, for example, who will say things that are ridiculous. The United States is the best healthcare in the world. Do we? Well, I mean, look, let's be honest. The United States is capable of having the best healthcare in the world. And there is a certain segment of the population that does get the best healthcare in the world, but it only applies if you're rich. So, yes, rich people get the best healthcare in the world, but what about the rest of us? Well, as you're going to see, the rest of us are screwed. Now, the analysis found that compared to other high income peers, the United States has the shortest life expectancy at birth, the highest rate of avoidable deaths, the highest rate of newborn deaths, the highest rate of maternal deaths, the highest rate of adults with multiple chronic conditions, and the highest rate of obesity. So let's get into the nitty gritties here. Life expectancy, for example. Well, let's look at that. Now, in 2020, the average life expectancy at birth in the U.S. was 77 years. Now, in 2021, it actually got worse, going down to 76. But in 2020, the life expectancy of the United States was 3 years lower than the average for high-income countries. In fact, the next lowest life expectancy among high-income countries was the UK, which had a 2020 life expectancy at birth of 80.4 years. So you might be thinking, well, okay, it's 3 years. Yeah, but that's 3 years more that, on average, that you're alive, that you're living. I would say that that's a pretty big deal. 3 years is a decently long time to stay alive. Now, what's interesting here is that, again, 77 years in 2020, that's the same as Cuba. Now, I bring that up because it's a great example of the priorities of our healthcare system. So in the United States, we have a priority of treating people once they get ill. In Cuba, they don't have the resources to do that. In Cuba, they prioritize not treating people when they get sick, which, by the way, the United States is actually really good at treating people when they're sick. That's why one of the reasons we do have a high health, that high of a life expectancy, and why people can claim that we have the best healthcare in the world. Again, we can do all these miraculous things when it comes to medicine, but we're really only doing them for the rich, for wealthy people. And so Cuba can't do that, but they focus all their energy on preventative medicine, making sure that small issues do not become large issues, and they're able to keep people alive longer. And again, they do it with no resources. So now, look, in America, people go with for years without seeing a doctor, and it's because of the high costs. Now, small problems will turn into bigger problems that are far more expensive in our system, and people will choose not to get those problems solved because they don't want to put that financial burden on their family. And so, as a result, if things get worse, they die sooner. That's what happens. Now, they also found the U.S. continues to have the highest infant and maternal mortality rates. In 2020, there were 5.4 infant deaths per 1,000 live births in the United States, while average among high-income countries was 4.1. In Norway, there were 1.6 per 1,000 live births. So now hold on here. That's really high in this country. I thought we had an entire political party that was pro-life. I mean, they go around, they talk about how pro-life they are. Oh, we're so pro-life. We're going to protect the babies. We're going to protect the children. But when it comes to infant mortality, they're not protecting the children at all. You know why? Because they're preventing people from getting health care. They're preventing people from being able to afford to get things like prenatal care. They're allowing all these infants to die so that health insurance companies and hospitals and whoever else to fill their pockets. Again, you know what would actually help reduce maternal and infant mortality? Healthcare. Expand healthcare. Now, what are Republicans trying to do right now? They're trying to cut Medicare. Now, there are also corporate Democrats, by the way, that may agree to cut Medicare. But there are also corporate Democrats, mainly along with the Republicans, that refuse to expand Medicare to everyone, which would actually solve the problem. If you expand Medicare, a single-payer healthcare system like all the rest of these countries, then you would solve a lot of these problems. But they're not doing that. In fact, there's not even a public option, which was promised all the way back during the Obama administration, and they immediately gave up on that. Biden promised, again, immediately gave up on that. We haven't heard anything about a public option. This was even during during COVID, a pandemic, still refusing to do universal health care or even a public option. That is just absolutely, irresponsible, for one, and morally repugnant, tragic, whatever word you want to ascribe to this, it would work. And again, under a Democratic administration. All right. But anyway, look, and again, there's a reason why Republicans and corporate Democrats have gotten together to just not expand healthcare. They're bought off by big pharma, hospital groups, insurance companies. All of them make money in this current system, and all of them buy off our politicians. And that's what it is. Now, there's more. Maternal deaths. In 2020, there were 24 maternal deaths per 100,000 live births, about 2.5 times higher than the average for high-income countries. And so, again, people are dying. And look, the majority of this, I don't even have to look at the demographics to tell you which populations are more susceptible to maternal deaths. Black women, African-American women have a much higher maternal death rate than white women. And there are different reasons for that, mainly socioeconomic. There's also issues with, of course, the medical community not believing Black women when they have symptoms. And generally, by the way, also not believing women when they have terrible symptoms. There's other issues as well. Preventable and treatable diseases. They're, of course, killing people, Americans, at a far higher rate than in all the other high-income countries. In 2020, 336 deaths per 100,000 people were avoidable. The average among high-income countries was just 225 per 100,000. The rate of avoidable deaths has been rising in the U.S. since 2015, the analysis notes. And look, one of the reasons for that, they point out, is Americans having multiple chronic conditions. In fact, in 2020, 30.4% of U.S. adults said that they have been previously diagnosed with 2 or more chronic conditions in their life. Among other high-income countries, no more than a quarter of adults reported having 2 or more chronic conditions. Now, part of that also could be the fact that, the U.S. has a higher obesity rate than any other high-income country. In fact, it's nearly 2 times higher than the average of its peers. I'm speaking to you as someone who is also overweight. So, I'm not gonna deny that. Yeah, I am overweight. I'm one of those people. So look, is it partly a result of the food that we eat? Of course. Yeah, that's a major thing. Diet and exercise, of course, super important. Again, glass house here. So I'm not going to throw any stones. But that said, and not in my case, but a lot of people, or I should say, a good percentage of people are overweight, not just because of a result of their diet. There are also lots of different factors that determine obesity other than just diet and exercise. And look, for example, medication. There's medication for things like depression, anxiety, bipolar, that will cause changes in metabolism. And people will, in order to treat one condition, develop other conditions due to weight gain. There are things like that happening. Okay, so yeah, medication is one of those things that can definitely feed into obesity. And then, of course, you get multiple diagnoses, multiple conditions that you have to manage in a system where, by the way, a lot of people cannot afford pharmaceutical medications. So, no, that said, despite all this, everything that I have mentioned, Americans spend twice as much as the average of other countries when it comes to healthcare. In fact, 17.8% of the massive GDP of the country was spent on healthcare in 2020. Other countries spend 9.6%. These are other high-income countries. On a per-person basis, average costs per person via government insurance, private insurance, and out-of-pocket is $12,000 a year. The country that came the closest to spending to the U.S. was Germany, with a little over $7,000 per person. These high prices that we pay uniquely, right, are discouraging, of course, people from going in and getting preventative care. Can't afford it. Can't afford it. Even if you have insurance, might not be able to afford your copay or your deductible. And that feeds into the country's high rates of chronic conditions and avoidable deaths. And in the analysis, the U.S. also had among the lowest rate of doctor visits, which is 4 per year. The average, 5.7. U.S. also has one of the lowest rates of practicing physicians per 1,000 people, 2.6 per 1,000, while the average is 3.7. Now, the amount of physicians, that's attributable to actually having the high cost of education. These doctors have to go through a lot of school, medical school. I have an in-law that's a PA. It's over $100,000 to pay for that education. Not many people can afford that or want to take out that amount of debt. And then, of course, if you do, well, you're not going to want to, go to a system where you're reimbursed less. You're going to go to a place that pays you more. And of course, as a result, they're going to take that from insurance companies or people's out of pocket. And so we have this entire contrived healthcare system that is private, for profit, and utterly hostile to consumers. That's it. That's why we have all of these results. Our privatized healthcare is killing us. Wealthiest country in the world. Same life expectancy as Cuba. Again, we have a system that is set up to give you only give you the correct kind of healthcare if you are wealthy. And to top it off, the report notes that the U.S. is the only high-income country that does not guarantee health coverage to every single person. We have to have Medicare for all. We've got to go to a single payer healthcare system. The current system is killing us. And it will not get better until we take the profit motive out of medicine. And of course, unfortunately, in order to do that, we've got to take the greed out of Congress. We've got to, have them stop the lobbying, get the money out of politics. And so one problem feeds into the other. But it all starts with greed.